I'm here with Ian Jennens, who's an infectious diseases physician at Royal Melbourne Hospital and the Epworth Hospital. Thanks, Ian, for answering a few questions about vaccination. Can you tell us why you think vaccination is important?
Vaccination's been around now for 50, close to 100 years when it was first introduced as a way of reducing the probability of coming down with an infection. And we all know infections, depending on the type of infection, can be quite severe with fatal consequences. Vaccination is an important invention, if you like, that reduces the probability of human beings getting sick with these infections and dying from these infections. It's made an incredible contribution to the length of life of humans in this century.
In your practice, where do you see the biggest effects of vaccination?
Probably talking to older physicians or older general practitioners who practiced in an era where there were diseases like polio and like measles. In my practice of infectious diseases, I've been working in medicine now for 30 years or so. We rarely see these acute infections. Polio, acute polio, I've never seen. I've heard of 2 imported cases in Melbourne in 30 years. Measles, we still see sporadically these days, but as a rare infection, whereas these were routinely diagnosed and managed by general practitioners and specialists when I was a child or before I was a child. So I think I'm living in an age where these diseases are rare. Many doctors never actually see these diseases now because of vaccination.
But they aren't totally eliminated, are they? Where are smallpox and polio a problem in the world?
Well, smallpox is the one example where the disease has actually been eliminated, which is an amazing, because this is a totally human disease, we've been able to completely eliminate this as a infection which carried high morbidity and mortality before. Measles, we've managed to reduce the transmission significantly, but unless you can, like we did with smallpox, vaccinate the entire community or then track down cases and vaccinate around it to completely eliminate it, it's very difficult to eradicate such an infectious transmissible disease as measles.
Which brings us to the idea of herd immunity. Can you explain what herd immunity is?
Herd immunity is the concept that once you can vaccinate to a certain level in the society, so that a certain percentage of people have immunity to measles, then you can reduce its chance of being transmitted in the community, so that there's so few cases developing that the chance of a person who doesn't have immunity, either from not being vaccinated or from immunity wearing off, comes into contact with the case of measles, the chance of that is so low that the probability of them getting measles and then transmitting it to more people is reduced. So if you can get to that stage in a community where most people are vaccinated, then the chance of you can eliminate transmission, the chance of that virus transmitting in the community is reduced. And so when a measles case is imported into, let's say, Melbourne, there might be a couple of sporadic cases of transmission, but then because most of the community is vaccinated, it dies out.
So what level of coverage do you need to keep in the community to maintain that herd immunity?
We've managed to keep those sort of levels of 90-95% of the community being immune, either from the older people because they had measles as kids, so they were immune, or from immunising our children. Now, the early measles vaccine didn't have a good protective benefit. It might have been only 60 or 70%, and the antibodies wore off over time, so people lost their immunity. The later vaccine schedule is much more effective, and with booster doses at high school, we're getting at least 95% of people being immunised having antibodies. The concern, obviously, is people not being immunised increases that number that don't have immunity and increase the risk of transmission.
Who's most at risk if herd immunity drops?
Well, the people most at risk are those that are not vaccinated. So there's a small percent of people who are vaccinated who lose their immunity, but the people most at risk are those that aren't vaccinated. Now, measles, in most cases, is a illness that people recover from. So, young children, 95% of people will have an illness and they'll recover completely. But small percentages develop pneumonia, which can lead to long-term lung problems like bronchiectasis, and even smaller percentages actually develop measles encephalitis, neurological disease from measles. So that there are recognised rates of serious illness from measles that we used to, before I was practising, see a lot of as consequences of measles. Nowadays we see the leftover problems and only occasionally see the acute problems because the measles cases are so few. But even in my practice in the last 30 years, I've seen a case of measles encephalitis and a case of measles transverse myelitis. Young, healthy people permanently damaged from measles.
And what effect does global travel have on all this?
Yes, well, so in Australia, in Melbourne, we have high rates of immunity. In other countries of the world, there's not those high rates, so that your chance of travel, if you're not immune, if you're travelling to a country where measles is circulating, there's a much higher probability of getting measles than if you were living in Melbourne, and therefore bringing it back to Melbourne and spreading it around in Melbourne. So that a lot of our cases of measles transmitted in Melbourne start from an imported case that's picked up from someone travelling overseas, someone who's not immune, vaccinated at a time when the vaccine wasn't as good, or not having the vaccine, travelling overseas. So, in fact, that's one of the problems in even parts of Europe in the last 30 years has been because of breakdown of society and governments, vaccine programs haven't been as good. So that larger percent of the populations of young people aren't immune, and measles virus can be easily transmitted amongst those populations.
The measles vaccine has been criticised by anti-vaccination groups and has been linked to serious side effects. What's the evidence for that?
I think we can clearly say now that the evidence of the serious side effect that was linked to the measles vaccine, the autism, has been completely debunked. That was not science. That was a person producing results and publishing them that have since been retracted. So in fact there's no link between measles vaccine and autism, as was suggested. Of course, every medicine, every vaccine has the potential of side effects. Fortunately, with vaccination, the side effects are minimal, so that a bit of a fever, a sore arm are the main side effects, and they can happen. But there are the risk of severe side effects from vaccination is much less than the risk of disease, or even in particularly if anyone in their lifetime is going to be travelling overseas, which means anyone choosing not to be vaccinated or choosing their children not to be vaccinated means, yes, maybe they're safe in Melbourne, there's a small risk of picking up measles, but young children, as they grow up, they're going to travel overseas. They're going to be exposed to these viruses overseas when they're travelling. I think to make a decision not to vaccinate your children brings in the risk of not just that child becoming sick, but also he could bring infections back to Australia and infect other people. So it's not just an individual decision. Vaccination is a decision that we make for the society as well.
For the social good. Are all vaccines equally effective?
No, clearly. And in fact, it's been very difficult to make vaccines against various viruses. So we don't have vaccines against HIV or against dengue fever. So people have tried but failed. So some viruses, some bacteria, we've made vaccines for. Some of them are more effective than others. One of the old vaccines, the BCG vaccine for TB, is thought to be between -10 and 65% effective if you look at all the studies.
That's a big range.
It's a very big range. There's lots of different strains. There's lots of populations you're giving it to. So the good vaccines are things like the hepatitis virus vaccines, hepatitis A vaccine, hepatitis B vaccine is probably 95% effective in healthy people. Measles vaccination is very effective. mumps, rubella, tetanus vaccine, they're all good, effective, polio vaccine, good effective vaccines that have reduced the incidence of these infections in the world.
Are there conditions or times where you would advise against vaccination?
Yes, some vaccines are live virus vaccines and they shouldn't be given to immunosuppressed individuals whose immune system can't even fight a attenuated, weak strain of the virus that's used in a live virus vaccine. It's interesting, I mean, measles vaccine is a live virus vaccine, but it's actually recommended to be given in all children in Africa because you can show that the virus vaccine is actually beneficial, even though some of the population, some of the children may have HIV without knowing it and have suppressed immune system. You can still show benefit from the vaccine in those groups, but we tend to try and not give live virus vaccines to immunosuppressed individuals.
But presumably those immunosuppressed people are even more at risk than the general population of infection.
From the virus? Oh, from the natural virus, you mean, rather
Yes.
than the vaccine?
Yes.
Yes, I think that's a reasonable thing to say. They can carry the virus for longer, it can have more severe effects. So I'm just thinking influenza in immunosuppressed people can certainly be more serious a disease. So we recommend influenza virus vaccine for everyone because it reduces the chance of getting influenza, but we particularly recommend it for people at increased risk of severe disease.
So just to finish up, tell us a little bit about how the vaccination schedules that the government proposes or mandates are developed and how they're used.
Well, the government has been supporting and recommending vaccination over long periods of time based on evidence that these reduce illness and the cost of looking after sick people. So, in fact, it's got a huge cost benefit from the government. Now, I think any new vaccine that comes into the schedule has to show that it's beneficial and is likely to reduce the incidence of disease. So, before any new vaccine is introduced, it has a lot of work done on it to show that it's going to be cost over benefit. And as new vaccines are developed or the vaccines are improved, they're introduced into the schedule as their expert panel of vaccines would be recommending to the government and then instituted around Australia. So it's quite a complicated process to get a new vaccine up and running. So vaccines may be used in other parts of the world and it can take months to years before they get introduced into Australia. A good example would be the meningococcal vaccine that high school children get to reduce the chance of dying from acute meningococcal sepsis, which was introduced in Great Britain a year or two before it was introduced to Australia. So we've got our own regulatory systems that it takes time to get through before these things can be introduced.
So from your point of view, if you were advising patients or patients' families, what would be your recommendation about vaccination in general?
Well, I mean, I think what you need to do is take it from a historical perspective. You have to look at life today compared to life 100 years ago, and just you can look and see how much a benefit vaccination has been to human society. And you can explain this to people. Ultimately, it is their decision what they're going to do, but they've got to realise that they're not only putting children at risk who aren't making their own decisions, it's the parents' decision foisted on the children, but this may well live with them through their life into diseases that they may come into contact in other parts of the world. So I think, I mean, all of medicine, all of doctor-patient relationships are a negotiation, and people need to be aware of the benefits and the side effects. And if I would explain the benefits, and most people accept that vaccination have benefit, there are a small percent of the population that seem to have some difficulty understanding this. But if they simply look at what things were like 100 years ago compared to now, there's a clear benefit to vaccination.
Thank you, Ian. Thanks for your time and for your expert opinion about vaccination.
Thank you.